My name is Magda Nasher. I'm an acute medicine consultant at Whiston Hospital, Mersey and West Lancashire Trust. And in our unit, we work to reduce the number of unnecessary coagulation testing with an aim to reduce unnecessary waste. So in 2019, NHS England identified acute care as one of the most carbon-intensive clinical activities. Most of emissions stem from purchasing of consumables, equipment, as well as building energy consumption and staff travel. So we identified that about 40% of coagulation testing done on our unit was done without indication. In response to that, we designed a quality improvement project using model for improvement methodology and introduced a series of analog and digital interventions such as condition-specific order sets for our triage as well as routine blood testing on AMU. That has led to a reduction in the number of coagulation testing on AMU. However, later on we also introduced a digital intervention in the form of digital interface within the requesting system. This digital prompt asks the requester their specific indication for coagulation testing. If there isn't one, then the requester cannot proceed. This has actually proven to be very effective, and we have seen a significant reduction in coagulation testing and lab workload following that intervention. So we tested our intervention using the PDSA cycles, and our digital interface has proven to be very successful, which led to a reduction to about 10% of inappropriate testing from 40% previously. The success of this intervention led to it being adopted by other areas within the trust, and we've projected that the current reduced activity would lead to a reduction of about 44,000 tests a year. We calculated a financial savings, and that comes up to 130,000 per year. And also there is a significant environmental impact with reduction in emissions equal to 3.6 million CO2 equivalents annually. Climate change is one of the biggest health threats nowadays. We as physicians, we are at the front line dealing with climate change health impacts. And it is really important that we contribute to the mitigation efforts. Our project showed us that it really doesn't have to be complicated, that we can achieve significant environmental and economic gains by modifying our everyday practice. I think sustainability should be our forefront of our minds, and we should think about it in our everyday work.